Well, hypertension is one of the most serious risk factors for death from heart diseases and strokes, and is responsible for about 13% of all deaths globally. In South Africa, more than 1 in 3 adults live with high blood pressure, and it is responsible for 1 in every 2 strokes and 2 in every 5 heart attacks. Research has shown that a significant portion of hypertension is linked to salt consumption. And in South Africa, it's been found that 40% of salt is added during cooking or at the table. To highlight the negative effects of raised blood pressure and overall health, and to specifically call attention to the relationship between excessive salt intake and hypertension, we're joined by Doctor Pamela Naidoo, who is the CEO of the Heart and Stroke Foundation for South Africa. Dr. Naidoo, always a pleasure. Thanks so much for joining us on the program.
Thank you, Leanne. It's lovely to be with you and the viewers today.
Blood pressure. We've spoken about this for a very long time. I know this is not the first time you and I have had this conversation, but when we talk about blood pressure being a silent killer, there can't be more truth put to it, because you don't really ever know what your blood pressure is. But perhaps you can help us, unless you have it tested regularly. Perhaps you can help us know what the signs are of high blood pressure.
Yes, that's a great question, and it's not called a silent killer for no good reason. I think that the difficulty is that you won't know that your blood pressure is so high, nor would anybody be able to look at you and say, that you don't look well and so on. So it is so important to have your self tested. So the only way really to know where you stand in terms of your blood pressure is, particularly if you're over the age of 45, you should at least have your blood pressure tested annually. If you have no other risk factors, like if you're not diabetic, if you're not obese, and so on. And if you have all those other conditions, then you should certainly have it tested at least twice a year.
Yeah.
So it's a very difficult, it's complex, because you could also have familial hypertension. And that means that...
Yes, elaborate. What was I going to say? And that means?
Yes, that means that even if you live a relatively healthy life and you adopt all these healthy behaviors that we'd like to see happen, for example, decreasing your salt consumption and so on, if you have a family history of hypertension, it means you're genetically predisposed, and it's all the more reason why you should have yourself tested more regularly.
Indeed, and this is the reality, is that it's becoming more and more prevalent. And we spoke about some of the research in the introduction that in South Africa, more than 1 in 3 adults actually live with high blood pressure, and is responsible for 1 in every 2 strokes and 2 in every 5 heart attacks. Do you think these numbers are actually accurate? Because I can imagine, to a point, it's even higher, because there are no visible symptoms and signs of having hypertension.
Yes. I think thanks so much for highlighting that complexity, because there's 2 issues that you raised there. One is that it's so difficult to get accurate data in South Africa. You can in the private sector. In the public sector, it's a little more difficult. I think the systems have improved, but we can't say with a real accurate sort of conviction that this is the number. However, if you take smaller surveys that have been done, and you take the private sector data, you certainly find that it's a huge prevalence of hypertension. So if you have, for example, let me just give you the scenario of why it's so dangerous for us in the country. Is half of the adults are hypertensive. Half of those who are hypertensive know they're hypertensive. The other half don't know they're hypertensive. And of the ones who know they're hypertensive and are on medication, there's a very small proportion of those individuals who take their medication as prescribed. Now, we all know that, when you're on medication or drug therapy, you have to have a certain dose level in your system. So it's very difficult if you don't take your medication regularly. So how does that link to heart disease and strokes? So I think the way to know whether you're really at risk or not is to really be honest with yourself and ask yourself, well, what are the other common risk factors that you have? So if you smoke tobacco, if you have excessive salt consumption, you do not exercise or have no physical activity, you take excessive alcohol, consumption as well. And if you add all of that into a risk score, if you try and calculate a risk score, and then you go and take your blood pressure measure, and it's systematically or regularly high, then you most certainly have to have yourself medically checked and treated.
Sure. All right. I mean, that's good advice. It really is good advice to take. I want to talk a little bit about the recommendation about reducing salt intake, because this is a big issue, and I am guilty of this, I must say. I'm one of those people that before I even taste the food, I've already put salt on top of it, and then I'll decide to taste it. But I'm trying to stop that. I must say I've gotten a lot better at that. But there is a recommended daily allowance of how much salt we should have. And I think this is going to blow a lot of people's minds, that how little salt we actually should have daily. Talk to us about the salt intake and the issues around that.
Yes, absolutely. It's the sodium, the chemical is the sodium that's the culprit in the salt. And so therefore, even with the foundation, we're trying to drive the fact that people need to read the food label. So the front of pack label on your food product is so important for you to understand. But essentially, in South Africa, we, on average, adults take 3 grams more than they should. So the evidence is showing us that adults take about 8 grams of salt a day, whereas you should be taking 5 grams of salt a day. And that is 5 grams is sort of the rough equivalent of a level teaspoon, I would say. And so the World Health Organization also works with a lot of good, well-standing researchers, and so it is recommended for 5 grams a day. Now, if you look at your food, there's natural salt in your food. Then when we're cooking, we're adding that little bit of salt, right? Hopefully it's not a lot of salt you're adding to your food. So if you actually analyze this, there is no need for that salt shaker on the table. So, legislation is also important. I think industry, a lot of the good industry have complied, but a lot of smaller industries and the informal food sector in our country poses a little bit of a problem, because even if you're mindful in your own home, but you're buying takeout food, you're not sure if that particular supplier is going to be as mindful as you are. So it is difficult, but it's difficult to estimate accurately what is that 5 grams. But I do think that the starting point is to take away the salt shaker from your table.
Take away the salt shaker, and perhaps maybe it's also the junk food, because that we know, the salt intake there. And legislation is a big thing. I know that you've said that's the one thing that needs to be worked on. We know government went quite big on the sugar intake, but the salt, I'm not sure, especially when it is one of the major killers in South Africa, and we talk about strokes and heart attacks. Dr. Naidoo, I so want to talk to you more, but we've run out of time, unfortunately. But guys, just take note of what Dr. Naidoo has said. Just create awareness about the heart and the potential of strokes in all of this.